Hello, my name is Jared Dixon, and I'm doing this recording for my abnormal psychology course at Vincennes University. I'm going to talk with you about substance use disorder. Substance use disorder has a regional and local impact on the country and also here locally in Indiana. I'm going to discuss that a little bit. I'm also going to talk about the diagnostic criteria and symptoms associated with substance use disorder. I'm going to talk about the etiological considerations for SUD. We'll present a case study, meet Michelle, who's a former crack cocaine user. That'll give us a glimpse into an actual patient with substance use disorder. And finally, I'll end by discussing some of the current treatment options that are currently available to help manage substance use disorder. Most likely you or someone you know is either affected by or impacted in some way by substance use disorder. A Pew Research Center study surveyed United States adults back in August of 2017, and they found that nearly half, that's 46% of those surveyed, said that they have a family member or close friend who is either addicted to drugs or has been in the past. Gramlich 2017 is the citation there. That speaks to a high prevalence of substance use disorder in our country. And here locally, in our rural community in Knox County, substance use disorder has struck Indiana's farm and rural communities in an impactful way. The American Farm Bureau Federation cites that 74% of farmers and farm workers say they have been directly impacted by the opioid epidemic. 3 in 4 farmers say it's easy to access large amounts of opioids without a prescription, and only 1 in 3 rural adults surveyed said it would be easy to access treatment. And that's discerning that 2 out of 3 of those adults, if they needed help, maybe they would not know where to go. I'd like to turn now to talk about the diagnostic criteria for this particular DSM disorder and some of the symptoms that someone diagnosed with substance use disorder may exhibit. In the DSM-5, substance use disorder refers to a cluster of cognitive, behavioral, and physiological symptoms, indicating that the person continues to use the substance despite significant substance-related problems. So the disorder is characterized by cognitive, so ways of thinking, behavioral ways of acting, and physiological, so our overall health and well-being symptoms. And the kind of defining feature here is that there is persistent or continued use of the substances despite or regardless of consequences that may ensue as a result. So substance use disorders are identified when the recurrent use of substances results in functional or clinical impairment in any one of 11 various criteria that are outlined in the DSM. The 11 criteria encompass 4 broad categories. Those categories are impaired control, social impairment, risky use, and pharmacological symptoms, namely withdrawal and tolerance. Those 11 criteria we could consider the symptoms of substance use disorder. Now, in order to be diagnosed, an individual must meet at least 2 out of those 11 criteria within a time frame of 1 year, so over a 12-month period. I've listed here on this slide the 11 diagnostic criteria for substance use disorder, and you can see how those 11 symptoms or criteria fit into those 4 broad categories of impaired control, social impairment, risky use, and pharmacological symptoms. The DSM also allows for a diagnostic of severity of the disorder, ranging from mild to severe. And the way that diagnosis is made, or distinction of severity is made, is based on how many of the 11 criteria are met within that 12-month time period. If 2 or 3 of the symptoms are met by an individual, then the individual will be diagnosed with a mild substance use disorder. A moderate substance use disorder requires the presence of 4 to 5 of the diagnostic criteria, and a severe substance use disorder requires the presence of 6 or more of those diagnostic criteria or symptoms. I'd like to now talk about the etiological perspectives of substance use disorder. What factors may lead one to develop substance use disorder? Whether a person develops substance use disorder depends on a number of factors. The authors of our course textbook for this class, Beidel, Bullock, and Stanley, 2017, note a couple here. They say that the drug's addictive potential, so depending on the substance that the abuser is using, and also the characteristics of the person using the drug, are factors that depend upon whether a person may develop this disorder. Also, they note that some users are more prone to substance problems because of their genetic makeup. That speaks to the biological factors that influence whether someone may develop substance use disorder, ongoing life stresses and other environmental factors. And then Daughters et al. Did a research study that examined individuals' immersion in a subculture even that involves drug use, and that speaks to socio-cultural factors that influence the development of substance use disorder. Therefore, a combination of genetic and biological, psychological, socio-cultural, and environmental factors determine liability to developing a substance use disorder. I'd like now to introduce a case study. We're going to meet Michelle. Michelle is 59 years old, and she's a former user of crack cocaine and other substances. She's been in recovery for about a year now, and here she talks about the circumstances which she believes led to her use of substances, which ultimately led to a diagnosis for her of substance use disorder. I'll let you talk about her, listen to her, and then discuss her commentary.
Following other people, I didn't have a bad child life, so I can't blame it on that. It was just following other people, being curious about what other people else was doing.
So in her clip, Michelle talks about how she's curious about the social influences around her, curious about other people, what they're doing. She's kind of following the crowd and going with the group. We might call this peer pressure. So she talks about these social influences and peer pressure. These would definitely be an example of the social environmental factors which have contributed to her use and ultimately developing substance use disorder. Next, I'd like to talk about current treatments that are available to help those with substance use disorder manage. Some of the factors that I think are important when deciding upon appropriate treatment options are the specific substances that are being abused, a person's personal characteristics, and also a person's resources that they have at their disposal. I do note that this information does come from Beidel, Bullock, and Stanley, the authors of our textbook. They also note that treatment should be multifaceted, so incorporating different dimensions, different activities, and elements. It should be individually tailored to the patient, and it should involve family members and other significant individuals in a patient's life, the significant others and other loved ones. Now, for severe cases of substance use disorder, residential treatment may be helpful. In general, the longer the treatment, the more effective and beneficial it does tend to be. That's related to the 5th treatment guideline set forth by the National Institute on Drug Abuse. It's been some time ago, but in 1999, they published 13 principles of effective treatment guidelines, which have steered the recovery and counseling community been helpful for them and steered them in a positive direction in guiding treatment efforts towards substance use disorder. I'd like to revisit Michelle's story, and she shares a little bit more about her experience with substance use disorder. And this is related to treatment, in that Schindler and Perrin found in their research that those who are diagnosed with substance use disorder, 50% of them will also have another psychiatric disorder. So it's important to consider that for those who are seeking treatment for SUD, it's important to also treat any co-occurring psychiatric disorders, such as clinical depression or any other psychiatric disorders that are present at the same time. Also, there may be some outstanding medical conditions or issues that have gone untreated or unnoticed. And now would be a good time to receive treatment for those issues as well. And Michelle actually addresses both of those issues in her testimony here.
To tell the truth, I didn't even really realize until I did get some help that I did have was depression, being depressed. And I never thought of it as a mental health issue. But, yes, I was really depressed. I had a lot of thoughts about suicide. Even tried a couple of times, and talking really helped because I didn't realize how dangerous it was, where it was taking me, not knowing. My blood pressure sky high, I didn't know that either. And just coming into a program helped me a lot, saved my life.
So her story ends on a positive note. She mentions how coming into a program saved her life. That's huge. Also, she notes that she didn't know her blood pressure was high. That was a medical condition that was unnoticed, that getting treatment for substance use disorder allowed her to address. And like 50% of those who seek treatment for substance use disorder, she had a co-occurring disorder of clinical depression that was also realized, and she was able to get hopefully treatment for that also. So her story is really great, and I'm glad we got a chance to learn about her. One thing that also just struck out in her story is she said just talking with somebody was so helpful, and something as simple as that can just go a long way and so be so impactful and make a difference for somebody. I think that's something to keep in mind. Now, in conclusion, I'd like to just summarize and say an individual may be diagnosed with SUD if they meet at least 2 of the 11 diagnostic criteria as outlined in the DSM-5. There are several different factors which contribute to the development of substance use disorder: biological, sociocultural, psychological, environmental, just to name some of them. And finally, substance use disorder, although it does seem to be on the rise and plagues our communities in many ways, it is a treatable disorder and can go into remission. Help is out there, and recovery is possible. Thank you for your time and for your attention. I've enjoyed this, and I've learned a lot through this experience. Thank you so much. Bye-bye.